All right. So thank you all for attending the first open house for the Encompass Mental Health Wellness Program's Awareness and Communication Series of 2021. The Encompass Mental Health Awareness and Communication Series will offer a 1-hour presentation every month, alternating between presentations regarding the program and service offerings. And we will also have some speakers attend on various topics on alternating months. So to start off this series, today's open house is just a broad overview of the Encompass Mental Health Wellness Program, how the program works, what services are offered, and how we've been able to support OPPA members and their families since launching in March of 2020. Some of you may have seen this presentation in the past, so we apologize for any overlap, but just wanted to start off the communication series with a broad overview, just so that everyone's on the same page with the offerings. And then we will be introducing new topics on relevant mental health and wellness topics over the next year. So just before we begin, there are just a few housekeeping items that I'll review. Your cameras and microphones will remain off throughout the presentation. This is in place to maintain your confidentiality. Additionally, no other participants can see your name. Number 2 is for all of those who couldn't join today, we are recording the presentation component of this open house, which will be posted on the Encompass website. We will cease recording when we transition to the Q&A section. Number 3, we will be hosting a Q&A after the presentation, so please send along your questions and feedback through the Q&A feature, which should be located in the menu bar for the Zoom webinar. Only panelists will be able to see your questions and feedback. This is not shared with the other participants. You can also ask questions or provide feedback anonymously by typing into the field and selecting the anonymous option that comes up. Our panelists, who you can see on camera and I'll introduce shortly, will review the questions and feedback and address their answers to the group verbally, again, without identifying the individual who sent the question. And if you don't want your question identified verbally, just let us know. Encompass is truly a program for OPPA members, and we really take this feedback seriously in the continued development and evolution of the program. So we appreciate your openness. And now for a brief intro into your panelists today. So my name is Michelle Goldsworthy. I'm a registered social worker and the Director of Operations and Program Development with Dalton Associates. And I'm joined by 2 other registered social workers and key managers for the Encompass program with Dalton Associates, Louise Hansen, our Manager of Corporate Client Relations, and Sarah Lyon, the Clinical Supervisor of the Encompass Care Management Team. And lastly, we will be joined by Dan Welsh, who is our Family Support Services Coordinator. So thanks again for your time today, and now we'll begin. So during this presentation, we're going to briefly review why Encompass was developed, then go through the program in some detail and end with Q&A. So firstly, why did we develop the Encompass Mental Health Program? What prompted the need for a program like this? So there's several challenges to accessing effective mental health support that spurs the need for a program like Encompass. These gaps exist across the board when it comes to mental health care, affecting many different populations and communities. But when it comes to first responders, particularly police and those in support roles within the organization, these gaps are apparent and can have significant consequences. So some of these gaps might include services that are not specifically tailored to first responders or police who have unique challenges and needs. A lack of knowledge, understanding, skills, and experience working with first responders can really impact whether a service is going to be helpful in the long run. As well, complicated pathways to accessing these services is definitely a gap. Sometimes the process is drawn out, unclear, and adds another layer of stress on individuals already experiencing challenges. Third, their pathways to funding might be complicated, whether a service is covered or not by a benefits plan, if there are other means of coverage, and how to receive reimbursement for services paid up front. Those questions, the answers to those questions might not be clear. Again, this adds to the stress on members and can impact whether or not individuals reach out for support. There is also limited or no service navigation, no point person one can access to answer questions, seek information, understand funding, and navigate access. While a myriad of fantastic support services may be available, navigating them may become a deterrent. And lastly, we know from our work in the North that there are very limited mental health services, programs, and providers in the North. We also know that working in Northern communities in a policing capacity brings a unique set of challenges and needs. Sometimes the only mental health support services available are ones that police may interact with in their professional capacity and may not want to reach out to when they need support. So again, another layer of stress and a deterrent to access. So that said, the Encompass program seeks to bridge these gaps and get people connected to effective mental health care supports that is tailored specifically to them. So these services are attuned to first responder culture, specifically policing culture, their challenges, needs, and realities. It's a program that centralizes access to resources. While there may be dozens of programs and support services available, we know that having a centralized access point that is readily available when someone needs support is key. This means that services are delivered with no wait list. There is wraparound comprehensive support service navigation and case management support. The service can't just be intake and a referral. Effectiveness comes from a model of care that involves ongoing follow-up and check-ins, sharing new information and resources that may be relevant or of interest to clients, and being that one point of contact for any needs that arise. This also means that clients don't have to tell their story, so to speak, many times before being able to access services. We also know that having access to interdisciplinary approaches to care means a more holistic experience. And so with various support service options, programming, and services provided by experienced, skilled, and culturally safe clinicians, are we able to deliver effective mental health support services? So this is what we seek to achieve through the Encompass program. So here is a visual overview of the Encompass Mental Health Wellness Program, the services that are available, as well as the goals that we hope to achieve. At the center, you can see the OPPA member. Encompass is for OPPA members who are currently in receipt of benefits, and that includes OPP Commissioned Officers Association members, as well as OPP retirees. There are also some program components offered to families of OPPA members in need of support, covered through extended health benefits and accessible through Encompass's Family Support Services Coordinator. In short, in the gray oval, you'll see the program components that surround the member, and I'll describe them starting at the top and moving clockwise. So the program is powered by Dalton Associates. We worked with the OPPA to develop a really comprehensive and culturally safe program. But as a third-party mental health organization, we deliver clinically led mental health care that is disconnected from both the association and the employer to ensure your confidentiality. And moving again to that 1 o'clock position, at the core of the program is comprehensive concierge-like care management. So eligible members have access to wraparound care management for their lifetime in the program. And there are also comprehensive support services offered by Encompass. Encompass not only navigates to existing services to reduce any duplication of resources, but also adds to these services, which we'll explore in a bit. And these support services are all pulled together in a client-tailored plan of care, which is mutually developed and determined by both the client themselves and their care manager. We offer in-person and secure virtual counseling options. DA has offered telephonic and virtual services for over a decade, but the pandemic has certainly meant that the majority of counseling is now delivered virtually. While we do have a small group of clinicians still offering services in person as an essential service, we do hope that the next few months will see things open up even more broadly. We are relaunching the Encompass client portal in March, and it is a fully secure, exclusive environment for clients to access their plans of care, self-assessment tools that are clinically validated and measure their progress over time, as well as access to exclusive and specifically curated suite of resources. And that includes courses, videos, webinars, podcasts, apps, etc. And that's all to support self-guided wellness initiatives. As many of you know and probably have visited, we do have a public-facing website, www.encompasscare.ca, and that has basic program information, updates, resources, and pathways to the program. And lastly, we are definitely committed to engaging with members of the OPPA, not only to share information about Encompass, such as this presentation, but to provide ongoing education related to mental health and wellness, as well as to continue in our commitment to improving and evolving the program to meet your specific needs. We found client feedback, again, to be a really critically important component of the program's development. And while we do have goals of being in person in various capacities, we definitely had these goals prior to launching the program in March of 2020. We have largely shifted to virtual engagement for now. So hopefully in the future, we'll be able to be in person again. And then surrounding all of this, on the outside of the oval, you'll see the goals of the program: to empower members, to promote and support mental wellness, to improve communication in one's personal and professional lives, to build strong and positive relationships, and to ensure a supportive work environment. All right, so now I'll take you through a little bit of information about Dalton Associates. And so we're the mental health organization behind Encompass. All right. So our organization was established in 1995 by Dr. Dan Dalton, who is a registered psychologist who saw the need for more accessible psychological services without the common wait lists that many clients have to endure. And it started by Dr. Dalton taking on master's level counselors under his supervision in the delivery of supervised psychological counseling, and has now grown into an organization that serves approximately 5,500 clients annually, delivered in over 75 towns and cities across the province, which continues to grow, by a team of approximately 15 psychologists and over 200 registered psychotherapists, registered social workers, registered nurses, some delivering supervised psychological counseling and others working autonomously under their own licenses. And this roster of clinicians also continues to grow. Within our general practice, we have bilingual care managers who are available via email or telephone and whom provide service navigation and advocacy to our clients. We also have a fully secure electronic practice management system, a process and outcome measurement platform powered by GreenSpace Health, secure counseling via our virtual clinic, which is On Call Health, and we offer services in over 25 different languages. Our 5 divisions of service include general counseling, where we deliver different types of counseling services to individuals, couples, families, people of all ages who come to us requiring support with a diverse range of challenges. We also offer psychological assessment services, which include psych ed assessments, vocational assessments, cognitive assessments, etc. We do have a full rehabilitation psychology division for individuals who have experienced motor vehicle collisions or workplace injuries. We have a behavioral health division and a clinic called Launch Behavioral Health. That's located in Toronto, and this division supports children, youth, and families affected by autism spectrum disorder and other behavioral and developmental diagnoses with wraparound support services. And lastly, the Mental Health Programs Division, which is built on strong partnerships with agencies, organizations, corporations, and communities throughout Ontario. It is in this division that we have developed strong partnerships with Indigenous communities in Northern Ontario, serving both in person and virtually when physical distancing or inclement weather prevents travel. And it is also in this last division that we initiated our programming for first responders, built with our first responder advisory team who help us shape our service offerings to ensure cultural safety and the relevancy of services. So now I'll hand it off to Sarah, who will take you through some components of the Encompass program in more detail.
That is wonderful. Thank you, Michelle. So the first thing I would like to take you through is the comprehensive wraparound care management model, which is at the heart of the Encompass program. Essentially, the care management team is the hub of mental health support services and the customized care model of the program. And what's great is that the care management team is available 24/7, 365 days of the year, which provides an unprecedented level of access to quality mental health care. At a practical level, how an OPPA member will actually access the Encompass mental health and wellness program You'll see through this diagram, it all starts when the member takes the first step to contact Encompass and that wraparound concierge model of care management. So the client can enter the program through a variety of means. They can call the toll-free 24/7 telephone line to access a care manager any time of the day or night. Or they can also send in a web inquiry or an email to info@encompasscare.ca, and one of our care managers will respond within 15 minutes. With their consent, someone can also refer them into the program, but I'll just note that we always do need to verify consent before we record any personal health information into our system. So once that contact is made between the OPPA member and a care manager, the care manager is going to initiate a triage and intake process. This is to build the rapport between the care manager and the individual, and it also serves to glean information from the client about what they might be struggling with and what Encompass services might be relevant to help. And it also ensures that if the person is in a state of crisis, they can be appropriately immediately supported. We do have access to a 24/7, 365 crisis line where we have crisis responders, and that's the first option that's presented to members who contact Encompass. If this is needed, the care manager will always personally stay with the member on the line until the crisis responder is connected in. The next pathway there, you'll see on the right-hand side, leads directly to the development of a customized and client-tailored plan of care. So this is where the client and the care manager are going to determine what support services should be accessed. And you'll see at the bottom of the image that there are quite a few service options with lifetime follow-up by the care manager. So the next part of this, our little flower here, is the mental health support service options. So the members of Encompass do have access to a variety of mental health supports. And these include the 24/7, 365 crisis line, which I mentioned. And again, this is a specifically trained group of support workers who are available around the clock to provide crisis and risk management services, de-escalation, and only if appropriate, connection to emergency services. The crisis team have a protocol in place that ensures that they support the client where they're at in that moment. And they've been trained specifically to work with first responders and have access to our clinical leadership team should that be required. And also with client consent, they are going to ensure that the care manager then follows up with the client so that the client can have access to ongoing and longer term support as well. There's also streamlined access to in-person, telephonic, and virtual or online counseling. The care manager will assist the client in choosing a therapist. I'll review that process in a moment, and ensure that an initial appointment is made available as soon as possible. Depending on the needs of the client and the availability of their preferred therapist, the initial appointment might take place anywhere from same day to about a week from the initial call to Encompass. And clients are kept in the loop as to the availability at every stage of that process. So our therapists on our roster do have a diverse skill set, experience, and clinical competencies, including clinicians who do serve the remote northern communities in the province. So next, clients also have access to streamlined psychological and psychiatric assessment services if appropriate. Our psychologists are available for consult with either the client or the clinician treating clients from the Encompass program, as well as being available for abbreviated assessments aimed at intensive treatment planning or comprehensive and diagnostic assessments. Psychiatric consultation is also available. We have residential and intensive outpatient treatment programs as well as part of the program. Our preferred provider network continues to grow, and it consists of several facilities, some of which are first responder specific and privately funded through the program, others of which are funded by WSIB or the Extended Health Benefit Plan and through Canada Life. For those interested in attending treatment, or a treatment program, I should say, a short treatment screen assessment will be set up between the client and their treating clinician. If they don't have a treating clinician, we'll set it up with our lead psychologist to determine whether the client is a good fit for residential or intensive outpatient care programs. And if so, they'll determine which program is the best match. If not, they will discuss alternative treatment plan recommendations to best support the client. When a client completes a residential or outpatient treatment program, they're provided with unlimited aftercare supports through the Encompass program. However, most of our preferred providers also provide some aftercare support as part of their program. So that can include peer support groups, psychoeducational or support groups facilitated by therapists, online resources and courses, and counseling with the therapist that they saw in treatment, or reconnecting to their therapist that they saw prior to treatment. Before discharge, the care manager and their therapist, if they have one, will be in touch with the residential treatment program and customize an aftercare plan for the client that is cohesive. It's the goal of Encompass to have the client in a session with their therapist, ideally the same week as they are discharged, just to ensure the continuity of care. Families can also receive mental health services through the program, and we have a designated support services coordinator available to specifically set up family of OPPA members with counseling and psychological assessment services as needed. The support services coordinator will check in with the family member to ensure that they're satisfied with their services and to connect them with additional supports as needed. Families can also access that 24/7, 365 crisis line. It's important to note that if an OPPA member has been to residential treatment, the family also does have the option to be included in the aftercare plan, as many facilities do have family-specific programming and education included. And families may require ongoing support as a member integrates back into the home. This, of course, all with client consent. For OPPA members who are on WSIB or LTIP, the Encompass program can support them with streamlined access to approved providers for assessment and treatment services, as well as navigating clients to support for any issues that might arise with their coverage. With client consent, we can support members in working with WSIB, for example, in activating treatment options, maybe residential treatment, if appropriate. Dalton Associates also has a full WSIB division, as Michelle mentioned, with approved treatment providers and case management, which has been streamlined with the Encompass program for those clients who wish for that support. And lastly, our care managers will assist the client in accessing supports that complement their plan of care and navigate clients to these services if it's appropriate for them. Our care managers will do research, they connect with programs and services that are outside of our roster, and we truly encourage a customized approach based on the member's needs that can go above and beyond what is offered with Encompass on our roster. We're currently exploring adding resources to our services as well. So these are, what we're looking at right now is rapid access to counseling, which ideally would be, same day rapid access, that we're hoping to develop that into 2021. Text and chat access, we're exploring that as well, and have a recent partnership with the Ontario Psychological Association, which gives us streamlined access to hundreds of psychologists in Ontario, in addition to the clinicians currently on our Encompass roster. So I just want to highlight that Encompass is a third-party clinical program, and as such, it's led by a clinical leadership team, which you can see here. So first we have Dr. Rakesh Jetley. He is our lead psychiatrist. Kathy Januziak and Jennifer Walsh are our lead psychologists. Michelle Goldsworthy, who's on the call, is our Director of Operations and Program Development. Manuela Joanno is the lead physician, and she's also the Director of Project Trauma Support. Myself, I'm the clinical supervisor of the care management team, and Louise Hansen, who also joins us today and is the manager of corporate client relations. So as a team, we meet once a month to review the program's progress and also to troubleshoot complex client needs and plans of care, all de-identified, to ensure that we're offering the very best clinical services. And the care managers also have access to the clinical leadership team if they are hitting any roadblocks or want some support around treatment planning. So regarding a client's tailored plan of care, as Michelle mentioned, this is what really pulls all the services together that are being offered and a client's being connected to. So the support services that I just went through are the options on each member's tailored plan of mental health care, depending on the specific challenges being experienced by that member and their expressed wishes and their goals and needs, as well as our clinical recommendations. The care manager will create a customized plan of care. And so myself as the clinical supervisor, like Michelle mentioned, I'm a master level social worker, and I review all of these plans of care with the care managers. And as needed, we include the clinical leadership team. And that's inclusive of the 2 lead psychologists, our lead psychiatrist, and medical physician who provide support as needed. So Louise, I will hand it over to you.
Good morning, everyone. It's a pleasure to be here. We're next going to talk about secure virtual counseling options. And as you know, with the pandemic currently underway, most services, and certainly mental health services in general, are being offered virtually. Our organization, though, in fact, has been offering telephonic and online virtual counseling for many years, which was certainly a benefit to us as we launched the program right as the pandemic was beginning and we moved into quarantine. In order to deliver that, the virtual counseling, we have a long-standing relationship with an organization called On Call Health, which provides a PHIPAA and PPIDA compliant secure clinical video conferencing environment for our clinicians, whether that's therapists or psychologists or psychiatrists, so that we can meet with clients when in-person sessions are not available. Well, that applies now due to the pandemic. It also ensures face-to-face services for individuals living in remote locations where there are limited to no therapists available, or when there's inclement weather or physical limitations that would prohibit somebody from physically attending a session. So even when COVID decreases, which hopefully we will see things opening up soon, and in-person services return really as the norm and the primary mode of treatment, this will remain an option for members to ensure those who prefer the convenience of virtual counseling or have other reasons for wanting to proceed virtually have that option to do so. Next, I'll talk about one of the features of the Encompass program that we have is a secure portal and a self-assessment portal. This is a secure environment which members can access, where they can access that customized plan of care that Sarah just talked with you about, as well as exclusive resources and information that is available just to members. We call this the Encompass portal. And as we speak, the portal is going through some significant upgrades, and we'll be launching this in early spring, March, early April. And we're excited to bring this to you. Now, as we look at this a little more closely, the members only portal is accessible through our public-facing website. However, it is a separate, secure platform where the care manager will share the documented plan of care with the member. And through this portal, clients in treatment will also have access to self-assessment tools where they can view and track their progress in counseling, and they can then process this content with their care providers as makes sense for each client. As well, members will have access to exclusive mental health resources that have been chosen and curated specifically for all of you. These are resources that are first responder specific or beneficial, online courses, educational information, and knowledge about mental health and wellness that really is aimed at helping to facilitate resilience and overall well-being. So really wanting to increase the number of kind of proactive and preventative services through this portal. We're really excited about our relaunch here that's planned for early spring. And we have some great new resources that we'll be including a course on anger solutions, strengthening marital relationships. We have psychological PPE through a partnership with Tend Academy, and some other great videos, courses, podcasts, and apps that are specific to first responders. So really excited about this launch and being able to bring these additional services to you. Now that we've been also mentioning kind of our public website as well, which is the encompasscare.ca site. This site also has a lot of great information. This is where you come to access the portal, but on this site itself, it provides information about the program. It provides service-specific information. For example, if you go here, you can see videos about the various residential services as an example. We have some great basic information on mental health and wellness. From this site, you can use our Find a Therapist tool to put in some criteria to help you search for a therapist that's a good match for you. You can contact us directly here, as Sarah talked about in the pathway to service. And we also have a number of resources available for family members in our family resources section. So all in all, a great resource for members and for your family members as well.
Thanks so much, Louise.
You're welcome.
Sorry, this is taking a second. There we go. So I just wanted to thank everyone again. Thanks to our panelists for their contributions today and to all of our attendees for joining us. We really appreciate it. And we look forward to being back next month for our first speaker in the series. More information will be made available in the next few weeks about that. So now we're going to shift to our Q&A session. Again, feel free to send us questions and feedback using the Q&A feature on the Zoom webinar menu bar. You are also welcome to email us anytime at encompass@daltonassociates.ca or provide feedback through our website. So now I'm just going to stop the recording